one of the biggest things that I find is that if I'm a great injector, if I deliver really great results, that's enough to run a business, and it's just not true. Another thing that we really struggle with is the amount of content that people are happy to put out on behalf of their brand on a weekly or a monthly basis. They're worried that it's going to come off spammy, it's going to be too much, whatever that looks like. But again, 7 to 10 touch points. We need to be making sure that we're out there all the time. But again, the competition is increasing. So we're competing to be heard amongst all these other clinics. So I find that some people are wanting to be a bit conservative in how much we're putting out on behalf of the brand across social media or whatever. You need to be a bit more aggressive.
Yeah. But what is that line where it crosses into being content for content's sake, not getting the engagement, which then can lead to you being punished by the algorithm because it just sees it as spam. So how do we find that? I guess there's like quality, right? There's quality of the content that you're putting out. And then how much, and you're just spamming people's feeds with stuff.
Well, I kind of look at the size of the business and the goals for growth of the business before I make a recommendation for how much content we should be putting out there. So especially when I talk to nurses, but doctors as well, when I have a discovery call with them, I ask them, what is your plan for the business? Is it just you? And if it's just you, are you wanting to be 5 days a week full-time in clinic, or are we hiring someone? What's kind of your plan? A lot of nurses will say, I want to do maybe 2 or 3 days because I want to keep working in the hospital. It's nice and consistent. And I totally get that. So we take a bit of a slower approach. We don't put out as much content for them because we can't manage too much growth. If they have 1,000 people call tomorrow and say, I need a booking straight away, they can't service that. So it's about managing that for them.